Hello everyone, welcome back to my channel. I hope you all are doing well. In today's video, I wanted to go ahead and cover a concept associated with anatomy and physiology, and it's widely used to measure the overall cardiovascular health. It's called cardiac output. Cardiac output is the amount of blood the heart pumps out through the circulatory system in 1 minute. It's a very vital measure that reflects the efficiency of the heart's pumping ability and the body's demand for oxygen and nutrients. It's measured using a very simple formula. The formula goes like this. It's heart rate times the stroke volume. So the heart rate is the number of times the heart beats in 1 minute. So another word to say it is beats per minute. Stroke volume, on the other hand, is basically telling you the amount of blood pumped out of the ventricle with each heartbeat. So let's just say it's volume of blood pumped out per beat. And when you multiply these two, you get the overall cardiac output. But before we get into that, you need to first understand the significance of these two variables, the heart rate and the stroke volume. The heart rate determines how frequently the heart contracts to pump blood. A faster heart rate can increase the cardiac output. So the higher the heart rate, let's just use blue for heart rate. A higher heart rate indicates higher blood pumped out, right? And vice versa. A lower heart rate would indicate that lower blood is pumped out. And this usually varies. So when we do physically intensive activities, the cardiac output will be higher in order to meet the higher oxygen demands during activities like an exercise. Conversely, at a resting rate, unless there is stress or anxiety or a panic, your heart rate wouldn't be high. It's normally very low, right? And the normal heart rate for an adult human being is anywhere between 60 to 100 beats per minute. Now, coming to stroke volume, right? Stroke volume, like I said, is the amount of blood pumped out of the ventricle with each heartbeat. So this quantifies the efficiency of the heart with each contraction. So every time the heart contracts, there is some blood being pumped out. Think of it like squeezing a water bottle to see when the water starts pouring out. So the harder you squeeze, the more water is pumped out. The lesser, maybe if you don't squeeze that hard, you don't pump out more water. It's like that. It's like a pump. The factors affecting stroke volume include the volume of blood returning to the heart. This is called the preload. Let's just say stroke volume. You've got preload. So this is the amount of blood that enters your heart when it relaxes, also called the end diastolic volume. A diastole is the time when the heart relaxes and it's filling itself up before it starts to pump the blood out, right? And then you've got something known as afterload. So afterload is the resistance that the heart faces while ejecting the blood, right? So that resistance is referred to as afterload. In other words, you also call it the end systolic volume. In other words, when your heart is pumped out blood, right? the amount of blood that is left in your heart after it has pumped out all the blood that it needs to, the remaining blood that's still there in your heart is the end systolic volume. And finally, you've got contra- con- contractil- contractility. I don't know why I'm suffering with the word. Contractility is the strength of the heart muscles contraction. So the amount of effort the heart has to put in order to pump out the blood. That's contractility. So just to build more on end diastolic volume and end systolic volume. So end diastolic volume again, it represents the volume of blood in the ventricles after the heart is completely filled itself, right? That's the end diastolic volume. Just before the heart contracts, how much ever blood is remaining there, that measure is called the end diastolic volume. And when you talk about end systolic volume, it means that the blood that is remaining in the heart after the heart is finished pumping the blood out, right? So the stroke volume is basically the end diastolic volume minus end systolic volume. When you get the difference of these two, you get the stroke volume. So let's just go ahead and simply plug in a few values. But before that, the average reading for the end systolic volume is anywhere between 120 milliliters, and the end systolic volume would be anywhere about 50 milliliters. So 120 milliliters is the quantity that is there in the heart after it has received all the blood, right? The ventricles are completely full. It's about 120 milliliters. And 50 milliliters is the amount of blood left in the heart after it has pumped out most of it. So, assuming that we take the difference between these two, that's about 70 milliliters. All right. And let's assume that the heart rate is anywhere between 70, 75 beats per minute, right? So let's just go ahead and multiply these two, and you get the answer as 5250 ml per minute. In other words, you could call it as 5.25 liters per minute. That's your cardiac output. So if this value falls within the normal range for adults, which typically lies between 4 to 8 liters per minute. It indicates that the heart is functioning efficiently, effectively delivering blood, and thus oxygen and nutrients throughout the entire body. This example demonstrates how cardiac output is calculated and interpreted, providing valuable insights into an individual's cardiovascular health, such calculations are critical in clinical settings for assessing heart functions, especially in patients with heart disease or those undergoing treatments that affect heart function. So I hope this simple explainer gives you an overall perspective or an idea about what cardiac output is and how to measure cardiac output, and more importantly, the significance of cardiac output in measuring how well your body's requirements are met. If you like this video, then like, share, and subscribe. Thank you so much.